If weight loss were only about calories, people eating salads would not be gaining weight. Yet, millions of disciplined people are not are doing everything right, eating less, exercising more, and their body refuses to cooperate. That's not laziness. That's not lack of willpower. That's physiology. Today, I want to explain the silent weight blocker most people were never taught: insulin resistance. Insulin resistance means your body needs more and more insulin to do the same job. So insulin stays high even when you are not eating. So let me tell you how fat storage works. Insulin is not a weight loss hormone. Insulin is a storage hormone. When insulin is high, fat storage turns on. Fat burning turns off. You cannot burn fat and store fat at the same time. Insulin decides. Insulin is a locked door. Doesn't just store fat, it locks the fat cell door. So high insulin is a locked door. Fat cannot get out. So what insulin resistance really is? Over time, cells stop responding to insulin. So the pancreas does what any organ would do. It produces more. Insulin rises and stay high chronically. And this is the paradox patients feel. This is why people say, I barely eat and I still gain weight. Because fat is locked away. The body cannot access it. So hunger increases, energy drops, metabolism slows. Not because you are failing, but because your body thinks it's under threat. And this is why a calorie alone failed. Calories measure energy quantity. They do not control energy access, fat release, storage permission. Insulin controls all three. Ignoring insulin while treating obesity is like discussing traffic while ignoring stoplights. So what is the visceral fat, the dangerous fat? The most insulin-resistant fat is visceral fat. It's the fat around the organs. It's inflammatory. It's hormonally active and extremely resistant to release. This is why waist size matters more than weight. This is the lab test most people never see. Many patients are told their labs are normal because glucose is normal. But insulin can be higher for years before glucose rises. By the time diabetes appears, insulin resistance has existed for a decade. You would ask why exercise sometimes doesn't cause weight loss. Legitimate question. Exercise burns glucose first, not fat. If insulin is high, exercise improves fitness, but not fat loss. This explains everything for many people. Let me be clear. This is not an excuse to eat unlimited food. And it's not permission to ignore calories forever. Calories still matter, but hormones decide whether calories are stored or released. Insulin resistance develops over years, and a reversal takes time, not days, not detox, not teas. You know, as a surgeon, I see insulin resistance everywhere. Vascular disease, fatty liver, poor wound healing, hernias, diabetes complication. This is not cosmetic. This is metabolic disease. And remember this. Insulin resistance is not a weight problem that causes disease. It is a disease that causes weight gain. If your body is not losing weight, it's not being stubborn. It's responding to signals, and insulin is one of the loudest signals in human biology. Once you understand that, weight loss stop being a character test and become a medical problem that can actually be solved. This is Dr. Ben Mamer. Hit follow to help me build momentum to fix healthcare in America.